Hi, my name is Effie Sperlin. I'm a licensed massage therapist in Charlotte, North Carolina, and today I would like to give you a brief video on how to do manual lymphatic drainage and a breast massage. We're going to start with a few landmarks. This is the clavicle, and also considered the clavicular chain, which runs right above the clavicle. This is the sternal area that we're going to be dealing with. We're also going to be dealing with the underarm, the axilla, and then the fold between the axilla and mid-clavicle. So we're going to be doing a process which I call 1, 2, 3. To clean the lymphatics in the breast tissue, we need to clean the lymph and closest to the heart, and the area closest to the heart would be the clavicular chain. So we're going to take our hand and run along the top of the clavicular chain very gently. I can use one hand this way and then I can use the other hand. This will empty the lymph closest to the heart, which allows the lymph to move from the area between the armpit and the clavicle up, and then it also allows what's in the clavicular, in the axilla area, to move on up. So when I empty this, it's a vacuum system. This fluid has to come up, and then this fluid under the axilla has to come up also. And then at that point, the fluid from the breast tissue has to come over to the axilla, move up, and empty. So I'm going to call this a 1, 2, 3 process. 1 is cleaning the clavicular chain. 2 is the area between the axilla or armpit and mid-clavicle. We clean that up. That's number 2. And number 3 is a flat hand under the axilla or armpit, pressing gently up towards mid-clavicle. So when we do this, first of all, always remember cleaning closest to the heart first. Second, this would be MLD 1 according to my directions. This is MLD 2, and MLD 3 is a flat hand under the arm, pressing up towards mid-clavicle. We do this preparation prior to the breast massage that I'm going to show you. Once again, I'm always cleaning closest to the heart first. Second, the area between the axilla and mid-clavicle, and then third, MLD, is going to be a flat hand under the axilla, pressing up towards mid-clavicle. All right, so now that we've prepared the lymphatic system and started the fluid moving closest to the heart, the clavicular chain, brought it up from here, and then a flat hand here, that's going to allow the fluid from the breast tissue to migrate to the underarm. So now I'm going to show you a massage that we add to this, that we suggest that our clients do daily for breast health. We're going to take the breast, we're going to break it into a clock. This is going to be, on this breast, this is going to be 12 o'clock, 2, 4, 6, 8, and 10. On this breast, same clock positions, 12 o'clock, 2 o'clock, 4 o'clock, 6 o'clock, 8 o'clock, and 10 o'clock. What we do is, to do the massage, I'm going to hold the nipple down with the same side as hold the nipple down with the hands closest to the same side. I'm going to use a flat hand with firm pressure. I can do this with oil on my bare breast, or I can do this in the shower with soapy water. So I'm going to use a flat hand. I'm going to press from 12 up to the clavicle, and then I'm going to lift my finger and do a gentle clean on the clavicular chain, just with one finger, very gently. So once again, 12 o'clock, I'm coming up, firm press, because I'm trying to push the fluid in the breast back to the retromammary space, which is the area closest to between the ribs and the breast tissue. Once again, 12 o'clock, up, firm, pick up my finger, rinse the clavicular chain. Now, for 2, 4, and 6, I'm going to take my hand and come out of the nipple. I'm going to go to the axilla or underarm. I'm going to do 3, 2, 1 at this point. I'm going to press gently, come up through this area with a flat hand, and then gently rinse the clavicular chain. I'm going to do 2 o'clock again. Out of the nipple, press gently to mid-clavicle, come up with a flat hand, lift, and rinse. 4 o'clock, I'm going to come out of the nipple, around, and then I'm going to do my MLD 3, 2, 1. 3, 2, 1. I'm going to move to 6 o'clock. I come out of the nipple at 6 o'clock, around, doing MLD 3, 2, 1 again. 3, 2, 1. For the 8 and 10 o'clock position, we actually take a flat hand and bring it to the sternal area and stop. 8 o'clock, out of the nipple to the sternal area and stop. For 10 o'clock, out of the nipple to the sternal area and stop. Again for 10 o'clock. And then we go and move to the other side, move to the other breast. When you're doing the massage, you can do up to 4 positions at 12, 4 at 2, 4 at 4, 4 at 6, 4 at 8, and 4 strokes at 10. That would be, when you do that to both breasts, that would be a complete breast massage. So I'm going to move over to the right breast again. Once again, 12 o'clock up, rinse. 2 o'clock is coming to the sternal area and pause. 4 o'clock to the sternal area and pause. The reason why I can come to the sternal area and pause is I have lymph nodes throughout the rib cage and along the sternal area. So it collects the lymphatic fluid that's coming out of 2 and 4 on this breast. And then we do 6 o'clock. Once again, 6, 8, and 10 is going to go under the axilla. So 6 o'clock out of the nipple, around, pausing under the arm, doing 3, MLD 3, 2, MLD 1. 6 o'clock again, out of the nipple, around slowly, using a very flat hand and slowly. 3, 2, 1. 8 o'clock, out of the nipple, over to the axilla, MLD 3, MLD 2, MLD 1. 10 o'clock, out of the nipple to the axilla, pausing and doing MLD 3, 2, 1 again. 3, 2, 1. With this process, you can clean the tissue out in the breast, getting rid of congested areas, encouraging oxygenation, and moving the lymph so that we can remove a lot of the toxins. Thank you.